As the most common cancer in men, understanding prostate cancer is vital. So I've come to Cambridge University Hospital to speak with Dr. Vincent Gnanapragasam to find out how they go about diagnosing this common cancer. Well, Vincent, prostate cancer is notoriously difficult to diagnose, isn't it?
Indeed. In fact, prostate cancer most often has no symptoms. A man might go to his GP because he has noticed a change in his urinary symptoms, getting up at night maybe, or having difficulty passing water, and most often that's due to a normal enlargement of the prostate as he gets older. In fact, prostate cancer doesn't cause any symptoms unless it's very advanced, in which case it might mimic some of those symptoms of an obstructed or large prostate. But if there are any concerns, the first step is to go and see your GP, who can then investigate further.
So what would your GP do?
Most often what they'll do is take a history from you, do an examination of the prostate, and do a PSA blood test.
What is a PSA test?
So PSA stands for prostate-specific antigen. It's produced by the prostate gland, and it's a marker for the presence of prostate cancer. However, it can also be raised in other conditions, so it's not a very specific marker, but it's the first test that we can do to say whether we should proceed to further investigations.
So what happens if you get sent to the hospital for an examination?
The specialist will see you, again take a history and an examination, and then most often what they will do is arrange a prostate biopsy. Increasingly, they might recommend a scan to be done first, an MRI scan, and then discuss with you what the best way to do a biopsy is.
And if it is cancer, tell us what happens then. Tell us about some of the tests.
Well, a discussion then starts. The first step is to make sure that we know exactly what kind of cancer it is, and that might involve other types of scans, for example, a CT scan or a bone scan. The kind of cancer is determined by the size of it or the stage of a cancer, and once the specialist puts all that information together with what the biopsy has shown, then they start to discuss with you what the treatments are.
So, now we know more about the tests, and the good news is that the majority of men diagnosed with prostate cancer survive for 10 or more years. For further information, visit the Cancer Research UK website or see the other videos in this series.